Bismillahirrahmanirrahim. Myself, Akil Haidar, on behalf of Genix Pharma, I welcome all of you. Let me give a brief introduction of Genix Pharma. Genix Pharma was formed in the year 2004 with vision to provide top quality and affordable medicines. Now, Genix is one of the fastest growing companies in national pharmaceutical industry. Today, our session is a part of educational activity. The presentation topic is Attention Deficit Hyperactivity Disorder, ADHD, presented by well-known consultant psychiatrist Dr. Raja Khetpal. Uh, Let me introduce Raja Khetpal to you. Raja Khetpal is leading psychiatrist in Psychosocial Center, Hilal-e-Ahmer. Psychosocial Center is well known for their services around Karachi. Dr. Raja Khetpal is F.C.P.S Psychiatry and has experience of 19 years in clinical psychiatry. Thanks a lot, Dr. Raja Khetpal, for your valuable time. If there is any question, please drop your questions in chat box. Over to you, Doctor.
Thank you so much, and welcome to all. And today we discuss a case of ADHD and the topic. So it's very interesting topic, and so we starting now. What is ADHD? ADHD, it is the second most common psychiatric disorder in children. ADHD, which is stand for Attention Deficit Hyperactivity Disorder. It is a medical condition. It is second most common disorder in childhood as a psychiatric disorder. ADHD has differences in brain development and brain activity which affect attention, ability to sit still, and self-control. ADHD can affect a child at school, home, and in friendships and other activities. Prevalence of ADHD is 2.2, and also in Pakistan it's 2.7, which is more common in boys than girls. And gender difference is that boys are more hyperactive than girls, and it is started at the age of 6 years, and which remains continuous symptoms for at least 6 months. It is symptoms should be at a developmental stage inappropriately, and which remains for 6 months at socially and across other activities, and it remains for 6 months associate and start before the age of 6 to 7 years. ADHD, also known as a hyperconnected disorder, it is other name, which is an ICD-10 international classification of diseases. It is also said hyperconnected disorder. ADHD in DSM-4, it is a term. ADHD के domains क्या हैं? ADHD के जो domains हैं, it is a inattentive, hyperactive, and impulsive. It is inattentive. It is the most common, in which kids are very inattentive, trouble focusing, their concentrating and staying on task. They may not listen well to direction, may miss important details, they may not finish what they start. They may daydream and dawdle too much. They seem absent-minded and forgetfulness and lost track of their things. It is inattentive type. Hyperactive, जो बच्चे होते हैं, those are kids who are very hyperactive. They are restlessness, easily bored, and not able to sit at one place, not taking quiet as doing his work. He is very distractible, and he is very prone to accident, and carelessly he pick up the things and run away from house, and it is very hyperactive. Impulsive type, it is kids who are very impulsive, act too quickly, respond too quickly, not concentrating, and it is very not taking part on in activities. They are not remain at the place and not very obey commands. They are very impulsive, and they may emotional reaction also seem intense for the situation. एक फर्क करें, कोई इम्पल्सिव कोई टाइप है, आप कोई गाड़ी चला रहा है, कोई साइकिल चला रहा है, वो अगर उसको कहीं पे वो रास्ता नहीं मिल रहा या बच्चे आपस में खेल रहे हैं, तो दे आर वेरी इम्पल्सिव, तो वो उसमें अब्यूजिव यूज करेंगे, लैंग्वेज यूज कर सकते हैं, दे आर मोर प्रोन उसमें वो होते हैं. And hyperactive impulsive वही हैं, the same age and time-based criteria above are necessary for ADHD diagnosis based on symptoms of hyperactivity impulsivity. Regular fidgeting and screaming, ignore instruction to remain seated or stayed in one place, moves about or feels restless in situation where such movement is inappropriately, can't participate in leisure activities quietly, excessive talking, blurts out answer before a question is finished, trouble waiting for their turn, often interrupt or intrude in conversations. They are hyperactive and impulsive type. And inattentive, for children up to 16 years, 6 or more symptoms of inattention must be present. People 17 or older must exhibit 5 or more symptoms. Symptoms कौन से हैं? Often makes careless mistakes, have difficulty staying attuned to specific tasks or activities, don't seem to listen when spoken to, fail to finish tasks or follow through on instruction, difficulty organizing, avoid or dislike long-term tasks, often loses trace of important items, easily distracted and often forgetfulness. Adult in first तो हम ये करें कि जो ADHD है, it is a heritability disease. 80% it is heritable and 20% वो होते हैं. And also there are some risk factors in जिसमें birth की आपको complications हो बच्चों में, low birth weight हो, and also those mothers are using substance use, alcohol and smoking, childs are more prone to develop ADHD. And ADHD also occur comorbidity with other illnesses like autism spectrum disorders, depression, anxiety, AMR, उसके साथ भी ADHD हो सकता है. और रेट्स जो है वो उसमें इंक्रीज है लो बर्थ वेट जिसमें हो, और जैसे मैंने जिक्र किया कि those mothers are who are taking substance like alcohol, cigarette smoking, and these are leads to abnormality in executive functions of the cerebral cortex. Mostly frontal cortex is prefrontal cortex is involved. इसमें जो वो region है वो involve होता है. For that जो executive functions वो हमारे उसमें prefrontal cortex का role है, उसमें हमें problem होती है उसमें. And also इसमें जो दूसरी चीजें हैं जो adult में है, adult में 20% ADHD हो सकते हैं. जैसे बच्चों में अगर वो हो तो उसमें those children who are diagnosed in the teenager and childhood also we can diagnose in adulthood, but in adulthood there is some form of aggressions जो they are more down and inattentive is more frequently उसमें वो होती है. And possible diagnosis with adult ADHD is usually only the cases if the disorder have been undiagnosed as a child, frequently being late and forgetfulness, suffering from anxiety, low self-esteem, troubling coping at work or struggling with unemployment, poor organization skills, difficulty completing tasks, short temper, difficulty controlling and inhibiting impulsive behavior, difficult imaging the consequences of impulsive activity, restlessness. इसमें जो है इनअटेंटिव इम्पल्सिव टाइप जो है वो परसिस्ट होते हैं अडल्ट में, एंड जो दूसरे हैं वो आपके चाइल्डहुड में वो ज्यादा वो उसमें वो होते हैं. एंड व्हाट आर द फंक्शनल कॉन्सिक्वेंसेस ऑफ ADHD? रिड्यूस पुअर परफॉर्मेंस, स्कूल परफॉर्मेंसेस आपकी कम होती है, ऑक्यूपेशनल परफॉर्मेंस इज वेरी डाउन, प्रोन टू डेवलप ट्रैफिक एक्सीडेंट एंड वायलेशन रूल्स एंड हाई रिस्क ऑफ अनएम्प्लॉयमेंट. Those who are severe ADHD, they are more prone to develop antisocial behavior. Antisocial behavior are more prone to other आपके जो risk behavior taking behavior होती हैं like substance use and unemployment, वो आपको लेके जाती हैं उधर उसमें. तो ये consequences आपके ADHD में ये सेम हो सकती हैं. And ADHD diagnose setting उसमें teachers, parents, child, ये तीनों मिला के हम टीचर से स्कूल से परफॉर्मेंस वी कैन उसके जो ले सकते हैं, पेरेंट्स से स्कूल चाइल्ड. इसको हम डायग्नोसिस के लिए एट होम एंड स्कूल दोनों चाहिए. DSM-4 कहता है. ICD-10 आल्सो सेज दैट किसी एक जगह पे भी अगर डिस्टर्बेंस है तो हम वी कैन डायग्नोसिस. एंड before going with therapeutic option to treat, and there are some important who can diagnose ADHD. ADHD is diagnosed by a pediatrician, psychiatrist, psychologist, and they have a experience in some childhood practice. They can diagnose. एंड ऑल्सो थेराप्यूटिक ऑप्शन जो है इसके इसमें बन तो एक तो ड्रग्स हैं वो फार्माकोथेरेपी एंड साइकोलॉजिकल थेरेपी इनिशियली दोज childs who are less prone or less severe symptoms they have very responding to psychological treatment psychosocial treatment में क्या आती है इनमें पेरेंट्स ट्रेनिंग है टीचर ट्रेनिंग है and they have give full information about ADHD and symptoms. Parents of the child are very fatigued and more prone to develop stress because of this unmanageable conditions at home, and they are more prone to develop. For that reason, parents are needed support and help. We can give them in the form of the counseling, in the form of literature. We can इंफॉर्मेशन टीचर्स के लिए भी इम्पोर्टेंट है टीचर्स को भी वो इंफॉर्मेशन देनी चाहिए उसके बच्चे के लिए कि सारे सिम्टम्स क्या हैं वो डायग्नोस वो कर सकते हैं उसमें आल्सो रिवार्ड सिस्टम है कि आप बच्चा कोई अच्छा काम करता है तो उसको आप रिवार्ड सिस्टम आप दें उससे ये चीजें आपके बच्चे में डाउन होगी साइकोलॉजिकल ट्रीटमेंट आर इम्पोर्टेंट इन दोज हु हैज ए mild to moderate type of ADHD, not a severe may also need with psychological treatment, also therapeutic options, pharmacological treatment. In pharmacological treatment, there are some stimulant drugs, methylphenidate, amphetamine, and non-stimulant drugs, atomoxetine and clonidine. First line drugs are methylphenidate, amphetamine, and these are we give stimulant. They have a role in to increase the dopamine level and non-adrenaline. Those chemically there are some dopamine and non-adrenaline deficiency occur in ADHD. As a neurotransmitter in non-adrenaline, there is central nervous system norepinephrine increase alertness normally and arousal in speed reaction times. Norepinephrine has been shown to play a role in person's mood and ability to concentrate. Low level of norepinephrine may lead to the conditions such as ADHD, depression, and hypotension. Another, there is a dopamine. Dopamine level can affect patient's mood, attention, motivation, and movement. Dopamine also regulates the brain reward system. With its level increase the brain activity when a person experiences something pleasurable, such as eating foods or doing good things. And the reward system जो साइकोलॉजिकल हम देते हैं वो भी इसी पे से काम करता है वो आपका डोपामाइन आपका रिलीज करता है दे हैव मोर चांस ऑफ टू इंक्रीज डोपामाइन लेवल रिलीज रोल ऑफ डोपामाइन एडीएचडी वही चीजें रेजिंग लेवल ऑफ न्यूरोट्रांसमीटर डोपामाइन इन फ्रंटल कॉर्टेक्स ऑफ द ब्रेन सिग्निफिकेंटली डिक्रीज इंपल्सिविटी इन हेल्थी एडल्ट्स एंड ए स्टडी कंडक्टेड बाय रिसर्च एटलीस्ट रिसर्च हुई है यूनिवर्सिटी ऑफ कैलिफोर्निया में वो देखा गया है कि ये आपकी फ्रंटल कॉर्टेक्स में ये चीजें डोपामिन की लेवल बढ़ने थे क्योंकि एग्रेशन जो होती है ये कहते हैं कि डोपामिन लेवल जब आपकी कम होती है तो आपका एग्रेशन बढ़ता है ये जैसे सुसाइड पेशेंट में भी ये देखा गया है कि वो उसकी जो लेवल है डोपामिन की वो कम उसमें वो हो जाती है impulsivity is also risk factor for adding so many substance it has been suggested that people with lower dopamine level in prefrontal cortex tends to be more impulsive said वही चीजें इसमें एटोमोक्सिटिन जो है वो it is one of the chemical in the brain called non-adrenaline epinephrine जो है norepinephrine the transmitter released from nerve endings to carry message from one nerve cell to another brain atomoxetine it is a non-stimulant drug atomoxetine actually हमारे brain में when there are synapses norepinephrine released from one nerve endings and then give signals to another nerve endings in between there is a synaptic cleft there is a level of the norepinephrine is available when increased level automatically in there is a reuptake of the norepinephrine वो degrade होते हैं norepinephrine फिर वो चीजें वो रीअपटेक होती रहती हैं। एटोमॉक्सिटिन जो होती है वो रीअपटेक को ब्लॉक करती है, वो नॉर एड्रेनल लेवल की साइनेप्टिक क्लेफ में वो आपकी इंक्रीज लेवल कर देती है। दैट्स व्हाई एटोमॉक्सिटिन एज अफेक्ट उसका वो जो होती है। Non-adrenaline is taken up normally by nerve endings in the recycling process. Atomoxetine is the molecule that stops this process. This means the level of the non-adrenaline in the brain increase. Higher level of non-adrenaline in the brain help to make people more alert and ready for action. It should be increase your attention span and your concentration. Stop your acting on impulse without thinking. ये आपकी जो there is a neurobiology. ADHD is prefrontal cortex or cortex disease. इसमें dorsolateral prefrontal cortex, ventromedial prefrontal cortex, right inferior prefrontal cortex are the region which are mostly involved impairment of the prefrontal cortex is out of tune in ADHD. वही frontal cortex, so pyramidal neurons in prefrontal are hypothetically of tune, causing deficit signal. Specific malfunctioning brain areas within the prefrontal cortex theoretically mediate the various symptoms of ADHD. It is mechanism of action of atomoxetine, norepinephrine and dopamine level play a critical role in prefrontal cortex function. Pharmacokinetics of atomoxetine is atomoxetine well absorbed after oral administration and minimally affected by food. Atomoxetine has a half-life of about 6 hours. Maximum plasma concentration are reached approximately to 3 hours after dosing. There are some common side effects: abdominal pain, nausea, vomiting, dry mouth, constipation, dyspepsia. These are the common side effects of atomoxetine. And there is a severe side effect of atomoxetine. Rarely 1 in 5 lakh there is a liver damage. जो होता है, जो आपका वो सीवियर साइड इफेक्ट है, वो 5 लाख में से एक को होता है, वो लिवर डैमेज करता है. दिस इज सीवियर साइड इफेक्ट ऑफ एटोमॉक्सिटिन. And atomoxetine, who can prescribe atomoxetine? Or it is target audience. A pediatrician can prescribe it, neurologists, psychiatrists, and physicians who have some expertise in child practice. And there are some dosage, and 0.5 milligram per kg per day. Minimum after 7 to 40 days, we can increase. Target daily dose 1.2 milligram per kg per day. Children or adolescent over 70 kg body weight, जो 70 kg से above हैं, 40 milligram per day. Initially dose, minimum after 7 days 80 milligram per day we can use. We can give in a single dose or can divide it in 2 doses. And we cannot use atomoxetine those who have some problem like psychosis, epilepsy. There are some precautions we cannot use in these type of the conditions. And also those who are taking monoamine oxidase inhibitor, antidepressant, there is some very dangerous drug interaction. Also we can taking care in some other tablets, isocarboxyl, linezolate, methylene blue injections, and salicylin, phencyclopamine. These are the other injections. There is some drug interactions, and you should not use atomoxetine if you have allergic reaction also, and severe heart or blood vessels, because this can lead to hypertension, increased blood pressure, narrow angle glaucoma. This is ADHD related topic. Hope all of you are listening. And any question?
Sir, we have 2 to 3 questions for you.
Okay.
Number 1, can ADHD be cured or just managed?
Mostly till 12 to 13 years of age, mostly ADHD is also curable. It's within treatment, patients are responding to treatment, and these are the symptoms less, symptoms free patients. Some ADHD, I have already said that 20% which goes after 20 to 30 years to adulthood. Then.
Okay. Sir, another question is, can ADHD cause comorbid disease?
ADHD is also can cause it is can ADHD can with other comorbidities like mental retardation, autism spectrum disorder, anxiety, depression, but ADHD cannot cause other diseases. ADHD comorbidity with these diseases.
Okay. Sir, third question is, can stimulant and non-stimulant be prescribed together in
Uh,
ADHD?
I think no. If some stimulant is not responding to treatment or any because not taking due to any other reason, after that we can give non-stimulant. Both we cannot give.
सही. अच्छा सर, एक सवाल है, वो ये कह रहे हैं कि 6 साल के बच्चों को कैप्सूल खिलाना बड़ा मुश्किल होता है, तो कैसे? ये तो ओटोमोक्सिडिन आती कैप्सूल फॉर्म में.
हाँ, ये तो इशू है. उसके लिए ये है कि इनिशियली डायरेक्ट तो हम ये चीज जो नॉन स्टिमुलेंट है वो नहीं हम देते. इनिशियली वी ट्राइड स्टिमुलेंट. हाँ, फर्स्ट लाइन जो ड्रग है वो है मिथाइलफेनिडेट. Then if patient is not responding any other reason, then if any available, I don't know, available in syrup form or any other, I don't know.
सर, ये डॉक्टर मोहसिन साहब का एक क्वेश्चन आया है इनकी तरफ से. Any role of diagnostic test in ADHD in child?
Yes. There are some scales which can conquer rating scale जो है वो एक अवेलेबल है आपके गूगल पे भी अवेलेबल है. आपकी साइकियाट्रिक रेटिंग स्केल, conquer रेटिंग स्केल, वो ADHD में वो अप्लाई करते हैं, वो उसको उस पे डायग्नोस करते हैं.
अच्छा, एक सवाल और आया कि कैन मोक्सिडिन वर्क ऑन इनोरेसिस?
सॉरी, क्या?
ये कुछ इन्होंने लिखा हुआ है, ENU इनोरेसिस.
एन्यूरेसिस?
जी, इनोरेसिस जो है.
नहीं, तो वो क्या मतलब, वो
कह रहे हैं कि
ADHD में
मोक्सिडिन इसके ऊपर काम करती है कि नहीं, बेड वेटिंग जो है.
नहीं, बेड वेटिंग इज अनदर कंडीशन. उसके लिए फर्स्ट वी नीड असेसमेंट व्हाई बेड वेटिंग. देयर आर सम इमोशनल प्रॉब्लम्स एंड अदर थिंग्स, so we can initially not directly give ATOMOXETINE.
अच्छा सर, एक सवाल कि बेस्ट टाइम टू टेक मोक्सिडिन, मॉर्निंग इवनिंग, किस टाइम दी जाए?
Best time of the drug is I think morning, because there is some it leads to the increased blood pressure. Norepinephrine is a link some blood pressure. In the night maybe it can increase, so we can give in a daytime, and also we can monitor him for 2 to 3 hours.
तो आई थिंक इसके अलावा तो सर और कोई क्वेश्चन अभी नहीं आया. तो सर, थैंक यू सो मच आपके वैल्यूबल टाइम का. आपने अपना टाइम दिया और एक बहुत अच्छी प्रेजेंटेशन आपने जो दी. थैंक्स लॉट फॉर योर टाइम.
थैंक यू सो मच ऑडियंस का और आप लोगों का. थैंक यू,
बहुत बहुत. ओके सर.
थैंक यू. अल्लाह हाफिज़.